So let's talk a minute about the standard medical treatments that are out there. The first one, the most common one, is a class of drugs called SSRIs. SSRI stands for selective serotonin reuptake inhibitors. If you remember our discussion about neurotransmitters, serotonin is a type of neurotransmitter. It's a chemical that the brain uses to communicate between nerves. SSRIs help keep serotonin in between those nerves, like in the picture we saw before, so that there's constant stimulation to the nerves. This constant stimulation leads to perpetual communication to the brain in certain areas of the brain that make you feel happy, less depressed, and so on and so forth. For children and teenagers specifically, SSRIs are probably the most common medicinal treatment for anxiety. Less commonly used are the tricyclic antidepressants and or the benzodiazepines. Those are more commonly used in adults, though SSRIs are probably a favorite for adults as well. Every medical doctor that I've talked to about anxiety tells me that they wish that there was a different option out there. This is not ideal, and they're all willing to admit that very openly and very openly about that. Because the problem with SSRIs, one of the problems anyways, is that it has all those side effects. Why isn't that showing up here? Oh, there we go. Side effects associated with it. And some of the side effects associated with a lot of the common SSRIs include headache, stomachache, nausea, difficulty sleeping, worsening of symptoms. Anxiety is a side effect of SSRIs, oddly enough, specifically for Prozac, bupropion, mirtazapine, and a few others. Balance problems, drooling, difficulty speaking, restlessness, stiffness, dizziness, diarrhea, abnormal thinking, confusion, shortness of breath, seizures, convulsions, and of course the biggie is suicidal thoughts, especially if you get off these SSRIs cold turkey. That is a big one. Another problem with SSRIs is that the treatment of it does not allow for the brain to regulate itself. Remember we talked about the brain waves, right? Delta, theta, alpha, beta, and going from the from an aroused state, an active state, into a meditative state, and back and forth and back and forth. We talked about that. This decreases the brain's ability to do that, which can lead to some of these symptoms, side effects, and there's other mechanisms as well. Again, it's not ideal by any stretch of the imagination, but it's an option out there, and one that gives you rather immediate symptomatic relief. And for a parent of a child, a teen that's dealing with anxiety, especially one that's to the point where they are having those suicidal thoughts or tendencies, jumping into one of these might be the only answer for them right away. Something else that is a common treatment, cognitive behavioral therapy, CBT. This is talk therapy. This is counseling for your child, usually leading to teaching them skills in identifying the triggers that lead to their panic attacks and their anxiety, and then coping mechanisms when those do occur. I love talk therapy. I think this is a profound and wonderful way of addressing and dealing with these symptoms and these problems with kids. Now, there is a problem with CBT as well. We call it a top-down approach. Well, let me explain that just a little bit by using this next slide here. If we think of our problems, including anxiety, as an iceberg, the problem we see is the tip of that iceberg, literally, where underneath there may be an enormous amount of underlying causes, much of which we've talked about. The brain regulation, the metabolic compromise, is the brain getting the proper fuel, the structural compromise, which is always a piece, almost always a piece of the puzzle for most of these patients, and so on and so forth. CBT, while wonderful, and I agree, it's a wonderful therapy. In fact, our clinic is right next to a counseling office. And some of the counselors in there we have a great relationship with, and we send patients back and forth between them. The female patient I mentioned before, whose anxiety and depression began in junior high, we mentioned that. She was a referral to me from the counselor next door, who said, you know, we've done about what we can do with talk therapy. Is there anything that you can do? And so we scanned, and we saw the amount of beta in her, and we said, yeah, there's some stuff we can do. We tested primitive reflexes for her and found a spinal glut, and we said, yeah, there's stuff we can do. It's a top-down versus a bottom-up approach. Cognitive behavioral therapy and medicinal interventions are a top-down approach, dealing with the symptoms that we see on the surface. And again, there's nothing wrong with that at all, with the understanding that underneath there are some underlying causes of the symptoms that we're seeing on top. So I like to consider the therapies and the interventions and the diagnostics we do here in our office as a bottom-up approach, looking at those underlying causes and dealing with those so that the top-down approaches can be effective, if that makes sense. I hope it does. I don't have any problem with behavioral therapy. I think it is wonderful. Again, I think it's fantastic. Again, I've got a great relationship with the counselors next door to me and other counselors as well. And I feel that it is important and necessary to work hand in hand with them. Most anxiety and depression patients I will not accept unless they have a cognitive behavioral therapist that they're working with. And if they don't have it, I'll refer them next door. Because the hand-in-hand approach with our bottom-up and their top-down treatments is about the most ideal situation that I can think of in helping these things. And again, I don't take an anxiety or a depression patient without having those counselors on hand and having that relationship with them as well.